even though, even while we call Kerala as the God's own country, on the other side, we are also viruses on country. Thanks to the biodiversity of the Western Ghats, thanks to their vegetation, thanks to the climate, we get a lot of viral infections, and we had, and also our public health surveillance is very strong. And we detect most of these infections very early, and we were first in detecting the COVID, first in detecting Zika, maybe detecting many other viruses. And we also had outbreaks of new infections like Nipah, which was detected. And we also have a major diaspora traveling abroad and coming back, bringing more infections. So the necessity of having a virology institute was felt from a long time back. And this institute, the work of this institute, maybe the brain work of this institute started in 2017. The building was constructed immediately in 2018. We had a prefabricated building to begin with, like some 30,000 square feet, where we have the functional laboratories now. You will see that building on the extreme end. Then this is the new building that will be handed over to us very soon. So we will be adding up another 80,000 square feet. And we will be expanding our laboratories. And this building was inaugurated, the current building was inaugurated in 2019, and it became functional last year. And I joined here as the director 1 year back, last October. And now we are proud to say that we have started 6 laboratories functional. We have a molecular diagnostic facility which can detect around 88 viral parameters, and we have tie-up with the hospitals in and around Trivandrum and also in and around the vicinity. Some 50 primary health centers are giving us the samples. So we are offering public health services that way, and we are doing outbreak investigations. So we are becoming fully functional. And to extend our activities further, we wanted to initiate a conference, a seminar or a workshop. Then this question came up. So what should be our topic for the workshop? Naturally, any new institute with a virology, focus on virology, definitely we would have started with the infectious diseases, flavivirus infection, maybe respiratory virus infection. SARS corona was at its peak. We could have done with the coronavirus infections, emerging infections. But we chose a very different topic that is called monoclonal antibodies. We were sure that this will get an overwhelming response from the participants, because the last COVID pandemic, one of the major interventions that we reinvented or rediscovered was the plasma therapy. And it started with the convalescent plasma therapy, then it went to monoclonal antibodies very rapidly. Thanks to the new technologies, the monoclonal antibody has matured enough to deliver very fast. We had a hybridoma technology in the beginning, and we had subsequently different humanized antibodies, and now came the recombinant antibody technology, which can make more or less antibodies with very less reactivity in the human system. So I am extremely happy to have a very overwhelming response from all of you when we advertised for the program, and maybe from the very next week onwards we started getting applications and requests, and maybe at the end we had to say that now no more slots are available for the workshop, but maybe you are welcome to attend the talk. So we are streaming this live in YouTube, so I'm sure that there will be many more people who will be listening to the talk. And while choosing the faculty also, we were very careful. We wanted to have experts in the field who have hands-on experience and real background knowledge in the subject, rather than any like book-based knowledge, but they had actual practical, strong and knowledge, and also theoretical background. So we are fortunate to have wonderful faculty members for the workshop, and I am extremely thankful that they could find time to come over to Trivandrum and attend our program and give you enough exposure in the field.